Hi guys, this is Dr. Praveen Kumar Jaiswal, a senior consultant radiologist from Hinduja Hospital, Mumbai. So today in this video, we are going to discuss different lymph nodes of the neck and how to label them during the radiological reporting in CT scan, MRI, or when you are doing the sonography. So what I have observed that the students and the freshers, it's very difficult for them to remember different levels of the lymph nodes. And that's why I have tried in this video to simplify it so that you never forget during the reporting. Before going into the details, we should learn the basic anatomy of the neck first. So what we have learned during our MBBS classes that the neck has been divided into two compartments, two triangles by this sternocleidomastoid muscle. So if you draw a line in midline along the trachea and above the level of hyvoid, there is anterior belly of digastric and posterior belly of digastric. So this is called a digastric triangle. So digastric triangle has been labeled as level 1 of the any lymph node which is in this digastric triangle will be labeled as level 1, and this is anterior triangle bound anteriorly by the trachea, posteriorly by this sternocleidomastoid muscle, and superiorly by this posterior belly of digastric. So in the anterior triangle there are internal carotid artery and internal jugular veins passes in this anterior triangle, and posterior to the sternocleidomastoid muscle is the posterior triangle. So basically we have one digastric triangle, another one is anterior triangle, and there is a posterior triangle. So now we'll have to draw two parallel lines, one at the level of hyvoid, another one at the level of cricoid. So basically in this slide, what we are going to discuss level 1, 2, 3, 4, 5 and 6 lymph nodes. In the next slide, we will discuss about level 7, 8, 9 and 10. So grossly, in this slide, I will discuss level 1, 2, 3, 4, 5 and 6. So as I told, this digastric triangle lymph nodes are labeled as level 1, and anything above the hyvoid muscle in the anterior triangle is labeled as level 2. Anything below the hyvoid and above the cricoid, in between the hyvoid and cricoid in the anterior triangle is labeled as level 3. Below the cricoid cartilage is level 4, and in the posterior triangle it is level 5. And any lymph node which is anterior to the trachea in midline is level 6. So grossly what we have learned? Level 1, level 2, level 3, level 4, level 5 and level 6. In the next slide, we will learn in detail. So this is basically what we have discussed in the last slides. This is the digastric triangle, level 1. This is level 2 above the level of hyvoid in the anterior triangle. This is level 3 below the hyvoid and above the cricoid in the anterior triangle. And this is the level 4 below the cricoid cartilage in the anterior triangle, and level 5 in the posterior triangle, and level 6 anterior to the trachea in the midline. So this is in detail about the different levels. So what we have discussed earlier, this is digastric triangle of level 1. Now you see there is an anterior belly of digastric and posterior belly of digastric. In this digastric triangle, the area anterior to the anterior belly of digastric is labeled as level 1A, and posterior to that is level 1B. So any lymph node which is submental in location anteriorly will be labeled as level 1A, and anything below the level of the ramus of the mandible or at the level of submandibular gland will be labeled as 1B. So 1 has been divided into 1A and 1B. Similarly, the level 2 lymph nodes, which is in the anterior triangle above the level of hyphoid bone, if it is anterior to the internal jugular vein, it will be labeled as level 2A, and posterior to the internal jugular vein will be labeled as level 2B. So 1 is divided into 1A and 1B. Similarly, 2 has been divided into 2A and 2B by this jugular vein. Below the level of hyphoid, in the anterior triangle, there is level 3. So there is no division of level 3. But level 4, which is below the level of cricoid in the anterior triangle, has been further divided into 4A and 4B. 4A is at the level of thyroid gland, and anything below the level of thyroid gland at supraclavicular lesion area in the anterior triangle will be labeled as level 4B. Similarly, posterior triangle lymph node, which is level 5, has been divided by the level of the cricoid. Above to that will be level 5A, below to that will be level 5B, and at the supraclavicular region in the posterior triangle will be level 5C. So finally what? 1A, 1B, 2A, 2B, 3, 4A, 4B, 5B, and 5C and 5A. As I told earlier, this is anterior to trachea. In the midline, any lymph nodes will be level 6. So in this image, what we see, level 1, 1, 2, 3, 4, 5, and 6. Now we'll discuss about the lymph nodes at levels 7, 8, 9, and 10. Level 7 lymph nodes cannot be seen through surface marking during sonography because it is deeply situated in the neck at retropharyngeal space, entirely at the level of pharynx. It is located posterior to that. So entire length is level 7, which can be seen only on CT or MRI, not on sonography. So this is level 7 retropharyngeal space. Now coming to level 8, any parotid lymph node, intraparotid lymph nodes are labeled as level 8. Similarly, the buccofacial lymph nodes anteriorly at the level of maxilla is level 9. And retroauricular lymph nodes are labeled as level 10. So 7, 8 parotid, 9 buccofacial, and 10 retroauricular. This retroauricular has been further divided into retroauricular and occipital lymph nodes, 10A and 10B. Just to recall again, 1A in the digastric triangle anteriorly submental lymph nodes, 1B posteriorly in the submandibular level, 2A in superiorly in the anterior triangle anterior to the jugular, 2B posterior to the jugular, 3 between hyphoid and cricoid, 4 below cricoid, 4A at the level of thyroid, 4B below that supraclavicular region, 5A in the posterior triangle, above the cricoid is 5A, below the cricoid is 5B, and supraclavicular is 5C. 6 is anterior to trachea, entire length, 7th in retropharyngeal, entire length, and 8th at the level of parotid, 9 buccofacial, 10 retroauricular, and 10B occipital. So these are the lymph nodes what we have discussed. Now we'll see actually how it is seen on CT images. So now we are at the level 1 at this submandibular level. So what we see, this is in the midline submental level, the lymph node is labeled as 1A. 1A. You can correspond on the CT image. and at the submandibular level it is 1B posteriorly. This is submandibular gland. Any lymph node at this level will be 1B. Similarly, at the same level, because we are at the level of suprahyoid, so this is the jugular vein. So anterior to anything jugular in at this level in the anterior triangle will be level 2A, and posterior to that will be level 2B. 2A and 2B, 1A and 1B. And if you see posteriorly, because we are at the same level, now you can see this is a lymph nodes retroauricular level. So this is level 10A. So we are at this level, 1A, 1B, 2A, 2B and 10. Okay. Now we are at the level below the level of hyoid and above the level of cricoid. So this is hyoid and this is cricoid level. So we are at this level. So anteriorly, this is level 6, anterior to trachea. Anything anterior to that will be level 6, and this is level 3 at the level of in the anterior triangle along the jugular. It is not divided into 3A or 3B. It's called level 3, and posteriorly at this level in the posterior triangle there is level 5A lymph nodes. So we are at this level below the hyoid and above the cricoid. Next level, now we are below the level of cricoid at the level of thyroid. So anteriorly, like the previous slide, anterior to trachea in the midline will be level 6. This is level 6. And then in the anterior triangle at this level, at the level of thyroid, anterior triangle will be 4A, and in the posterior triangle it will be 5B. So remember, it is 4A and 5B are at the same level, and 3 and 5A are at the same level, anterior and posterior triangle. Now we are at this supraclavicular level. So anterior to trachea in the midline will be level 6. We are at this level, and in the anterior triangle along the jugular will be level 4B. So we are at this level anteriorly. So here we are above the level of mandible. We have come up, and this slide at the level above the level of mandible, what we see is the parotid lymph nodes at the level of parotid gland, at the parotid space, 9 anteriorly at the buccofacial region, and 10A posteriorly, that is retroauricular, and 10B and the occipital. So 10A, 10B, 8 and 9, and as I told you earlier, this level 7 lymph node, which is retropharyngeal in location in entire length, can be seen only on CT or MRI. Any lymph node at this space will be level 7 from the level of mandible up to the level of clavicle. Entire length will be level 7. And this is 8, 9 and 10A and 10B. So we have learned different levels of the lymph nodes, but it is also very important to know about the lymphatic drainage pathway of the lymph nodes in the neck. So what you see that all the lymph nodes which are supramandibular in location, that is parotid lymph node at level 8 and buccofacial lymph nodes at level 9 and retroauricular and occipital lymph nodes of 10, they all drain inferiorly to level 2 lymph nodes, that is in the anterior triangle above the level of hyoid. Similarly, the digastric triangle lymph nodes 1A drain into 1B and finally into level 2 lymph nodes. Then the drainage pathway is from level 2 to level 3, that is between hyoid and cricoid cartilage in the anterior triangle, and the pretracheal lymph nodes in the midline at level 6, they also drain into level 3 and level 4, whereas the posterior triangle lymph nodes level 5A and 5B finally drain into the level 4 and below. And the final drainage pathway is at the supraclavicular lymph nodes, and then from there to the superior mediastinum. That's all about the lymph nodes and the different levels in the neck. I hope this will help you in your radiological reporting during CT, MRI, and sonography. Thank you very much. Have a good day. Bye bye.